السلام عليكم.
وعليكم السلام.
وعليكم السلام.
Okay, guys, today inshallah we will practice injured patient, but for joint examination. We have for practice Hadil, Fatima Safan also, Samodu. Okay, if anyone interested to practice, you can raise your hand. For joint examination, we have neck examination, back examination, shoulder, hand, hip, and knee. These are the most common stations. Okay. So in neck examination, you will use Canadian suspend rule as well. Okay. In back examination, you have two diagnoses. It could be sciatica or Coda-Equina syndrome. In upper limb, in joint examination for shoulder, you have tendonitis or acromioclavicular joint pathology or impingement or tear. So tear here, you have four muscles in the shoulder muscles. If any injury of one of them, so it could be tear or impingement. Impingement here, it means pain. The patient has pain, but he has good resistance. Tear, the patient has weakness. So if he has problem in any muscle, you will mention the name of the muscle only. But if he has problem in all muscles, so the problem in rotator cuff muscles. Hand examination, unlikely to find medical disease. So in previous exams, the diagnosis was cut in middle finger and the tendon flexor digitorum superficialis. Lower limb joints, so in hip examination, the patient has a fracture in the ramus, maybe unilateral or bilateral, maybe in the superior or inferior, or maybe both. In knee examination, you can expect fibula head fracture. How to catch this problem? When you touch the head of the fibula, the patient will close his eyes. So good eye contact in examination, very, very important. Patellar dislocation, how to catch this diagnosis? You will do patellar apprehension test. So in the end of the station, please mute your mic, guys. So in the end of the station, you will do patellar apprehension test. It means you will push the patella lateral. You will push the patella lateral. If the patient hold your hands and or close his eyes, it means it's a positive. It means a patellar dislocation. Degenerative meniscal tear. So how to catch this problem? Not trauma. So fibula head fracture, the patient has trauma. Patellar dislocation, the patient has trauma or fall. Degenerative meniscal tear, the patient doesn't have trauma. Meniscal tear, whatever degenerative, I mean, not trauma or injury, means there is trauma. So how to catch this problem? McMurray's test will be positive. So if positive for median or positive for lateral, it depends on the rotation of the ankle or the knee. Ligament injury, how to catch this one? When you do the test of the ligament, the patient is closing his eyes. Okay. Elbow examination, it's rare, and the ankle and the foot examination also rare, but it could come. So nothing is avoided. Hadil?
Yes, doctor.
Okay. So, Fatima,
Yes, doctor.
Hadil will do this station for 70 years and you will do the same station for 28 years, okay? So, your task to clear cervical spine and you will do neck examination, okay? So,
Okay.
you will take data from the patient regarding high-risk factors. You will ask him about the age, about what happened, how can I help you, can you tell me more? And then any weakness, numbness in your limbs, and you will follow also low-risk factors. So you will ask if you find the patient is sitting, so it's a low risk. If you find the patient is lying flat, it's a not low risk. Okay. You will ask him also, did you walk at any time after the injury? When did the pain start? Is it immediate? And you will touch the neck and check if he's closing his eyes or not. Okay. Regarding the patient, if he has any high risk factor, for example, he's 70 years, so you will do radiography, of course, but for the purpose of the exam, you will continue asking about the uh, high risk factors and the low risk factors as well. Okay. So
Yes.
for Hadil, the patient is 70 years, so you don't need to do movement, but you have to show the examiner. So for example, if you take the consent, I need to examine your neck. This examination involve look, feel, move, do some special test. But because your age is more than 70 years, more than 65 years, so I cannot do movement for your neck. Clear?
Yes.
It means the examiner will understand that you will not do movement. It means you mean that. Okay?
Yes, doctor. The movement only for the neck, but for the upper limb, I can do, right?
You can say for your safety, because your age is more than 65, I cannot do movement for your neck.
Yeah, neck.
Yes, be specific for the neck. Okay? Okay. So you will do examination for upper limb neurology as usual. Okay? And
Yes.
ideally, you have to do examination for the lower limbs as well. Okay. Regarding Fatima, you will do normal uh, Canadian Sisban rule, and then you will do examination upper limb neurology. So if the patient can rotate his neck, I mean not rotate, rotate here, it means left and right only. According to the algorithm, rotate left and right only. Okay, so no need for radiography at the moment. Then you will ask him to do cervical rotation in all movements. Okay, so look here, it means look from front, behind, sides for any abnormality, and then feel front, sides, and back for any abnormality. Check for tenderness, feel the pulses, carotid pulses, but after the bell of stethoscope. Okay, then you will ask the patient to do movement. Can you do like that? Thank you. Like that, like that, like that. Thank you. And mention the name of the movement. We finished now inspection. We finished the palpation. We finished the movement. And then you will go for special test, it means upper limb neurology. Clear?
Yes.
So you will check the tone. After that, the power. The power here for joints, shoulder, elbow, wrist, and digits. Clear?
Yes, please.
Okay, it will be long station because it's upper limb neurology and the Canadian spinal rule as well, right? So try to concise your answer. You have 30 seconds and 6 minutes, okay?
Yes.
So your task is 70 years. You can start.
Good afternoon. I'm Dr. Hadir Eidi, registrar. May I know your name and age, please? Okay. The patient doesn't speak English. I need translator.
Not available.
Okay. So, Mr. Your cousin, can you please ask Mr. Shaheen to attend with us and to be a translator as well? Okay. Thank you. Yes. How can I help you, Mr. Shaheen, today? Okay. Sorry for that. Do you have any pain right now? Are you comfortable? We have to check also vital signs and ABCD approach to check if the patient is stable. Thank you. Can you tell Mr. Shaheen, please, can you tell me more about your condition?
Yes, I was in a car accident and I called the ambulance. I came here
Okay, so when that happened?
1 hour ago.
Okay, so the pain started immediately after that?
Yes.
And could you walk immediately after the accident?
No.
Okay. And do you have any paresthesia in your limbs?
No.
Okay, so now the patient has age more than 65 and he has dangerous mechanism of injury, and so he have high risk. So we have to do a radiology CT scan for him immediately. Okay, so we have to exclude low risk factors. The patient with dangerous mechanism, so no rear end motor vehicle, and the patient also presented with injury. There is a pain started immediately, so no delay started of the pain, and there is also he can't walk after the pain after the accident. And so he have high risk, so we have to do a CT scan for him. Mr. Shaheen, I want to examine you that involve look, feel, and move. Examine your neck and upper limb, and you have to expose your upper limb also. And because of your age, I will not do movement for you. Is that okay for you? Okay. So now I will start by the inspection of the neck for any abnormality, for any deformity, inspection of the neck from anterior, sides, and behind. Then I will start palpation of the neck. First, I will palpate the spine, cervical spine, then cervical muscle. Is there any tenderness? Okay, and I will look to the eye of the patient for any tenderness. And Mr. Shaheen, I will auscultate your carotid pulse in the neck. Is that okay? Okay, so by the bill of the stethoscope. for any carotid bruit, then I will feel the carotid pulse for rhythm and rate. Okay, thank you. Now, Mr. Shaheen, I expose your upper limb. Ideally, I have to examine the upper and lower limb, but now I will examine only the upper limb. First, Mr. Shaheen, I will check the tone of your, please shake my hand, okay, the tone of the upper limb, and relax for me. And I will look also for the patient. Please tell me if there is any pain or tenderness. Okay. So then, Mr. Shaheen, please can you do like that? I will check the power of your upper limb. Don't let me push down for the shoulder abduction. Don't let me to push up for shoulder abduction. Thank you. Then, Mr. Shaheen, can you do like that? I will check. Don't let me to push up. I will check for the elbow flexion. Don't let me to push down for elbow extension. Then can you do like that, Mr. Shaheen, please? Okay, so now I will check for the wrist extension. Don't let me to push down. Don't let me to push up for the wrist flexion. Then, Mr. Shaheen, can you extend your fingers for me? Okay, don't let me to push down for the finger extension, and I will check for the radial nerve. Okay, Mr. Shaheen, don't let me spread your fingers for me, please. Don't let me to push your index in. Okay, thank you. Don't let me to push your ulnar, your little finger in. So thank you to check the ulnar nerve. Then put your finger like that, thumb finger like that toward the seal. Don't let me to push the thumb down. I will check for thumb abduction to check the median nerve. Thank you very much. Okay, so now I will do the sensation. I will check the sensation for your upper limb. Mr. Shaheen, I will check this on your chest. Okay, if you feel this, please tell me yes. Close your eyes, please. Okay. Can you feel that? Can you feel that? C5 intact. Can you feel that? Can you feel that? T1 intact. Can you feel that? Can you feel that? C6 intact. Can you feel that? Can you feel that? C8 intact. Can you feel that? Can you feel that? C7 intact. Okay, thank you. Then I need to check by this hammer your reflexes. Is that okay? Okay, thank you. I will check for the biceps reflex, for the triceps reflex, and for the supinator reflex. Thank you very much, Mr. Shaheen. Now I finish my examination. To complete my examination, I have to do a complete neurological examination for the upper and lower limb. And I have to also consult our neurologist to do CT scan for you and consult our neurological neurologist. Thank you. Do you have any further question? Do you have any pain? Are you comfortable? I will let you redress. Thank you.
Thank you, Halil. Okay, perfect. I think you covered almost all the points. You finished your time within 7 minutes. I give you more 1 minute. In the exam, it will be 8 minutes, no worries.
Okay.
So accuracy, you covered almost all the points. And supportiveness, you are doing very well. Proper empathy, sympathy, and giving instruction to the actor. Even me and your colleagues now, they are hearing you. They will feel you are doing well. Also, the examiner will be away from you, but from verbalization, he will understand that you are doing well, right?
Okay.
Even the Royal College in the camera, they will understand that you are doing well. Clear? Okay.
Okay.
So, supportiveness, well done. Good communication with the actor. I feel that the actor will understand you. Also regarding organization, very organized. Regarding skillfulness, you are not fluent 100%. Okay. I did not feel that you are preparing what to say. Did you get my point? So I
Yeah.
want you to be very fluent. Okay, for example, now I will feel the sensation in the upper limbs. Can you feel that cotton in your chest? Please close your eyes and tell me if you feel that in the upper. Can you feel that? Can you feel that? C5 pent. So I want you to be fluent like that. But anyway, it's a 90%, not bad. Okay?
Okay.
Well done. So I will give you a 9 out of 10. You are doing it very well.
Thank
You repeated in the beginning about Canadian spine rule. Okay. Um, Also, you jump to low risk factor without asking about paresthesia. Okay. You said dangerous mechanism of injury without evidence. You did not ask about the speed of the vehicle. Okay.
Okay.
So I said car accident. Car accident doesn't mean dangerous mechanism. Dangerous mechanism, it means
Mhm.
fall from elevation, more or equal 3 feet or 5 stairs. But anyway, it's irrelevant to this station. Axial load to head, diving, it's not relevant. Motor vehicle collision, this one relevant, so you should ask how much is the speed. Clear?
Clear.
And if the speed is less than 100, it's not dangerous. That's why you should continue asking. Any rollover? If he said yes, so it's a dangerous. Any ejection? So it's a dangerous. Clear now?
Clear.
Okay. So you should ask about the age. After that, how can I help you? If he said car accident, you should explore more to see if dangerous or not. And don't jump to low risk factor. You have to finish first the high risk factor. So any weakness, numbness, or abnormal sensation in forelimbs. Okay. Then you will go for low risk factors. After that, no need to ask him to rotate. You can talk to the examiner or talk to the patient. It's not a big issue. I think you covered this point. Well done. Then you went to the patient and explained to him. You said it's unsafe to do movement, but you did not say movement for the neck. You should be specific, okay?
Okay.
Okay, so already you did well regarding the uh, examination, but I felt like you are doing examination for one side. Okay, so when you say now I will check the tone, I want you to be fast and fluent. I want to check the tone in your upper limb. Can you shake my hand? Thank you. The other hand, thank you. If you say the other hand, thank you, I will understand that you did bilateral. Clear?
Clear.
Okay. Then now I will check the power in your upper limb. I will check the shoulder. Can you do like that? So I want you to verbalize the shoulder. I want you to verbalize the elbow and so on. You verbalize that after you ask him for instruction. No, I want you to mention the joint before the instruction and after the instruction. Okay. So
Okay.
I will check the power in your shoulder. Can you do like that? Don't let me to push down. Don't let me to push up. The other shoulder. You should say like that. Clear?
Clear.
So you are showing the examiner which joint. You are checking the power, the nerves. Okay. The status of the motor part of this nerve in this area, okay, in the shoulder. Well done. Then elbow also. I will check the power in the elbow. Can you do like that? Don't let me to push down. Don't let me to push up. In the other elbow. So can you see? I said elbow, elbow. And then rest, rest. Other side, other side. So these points very, very important to show the examiner that you are perfect. Clear?
Clear.
Yes. So I think you did well. I'm trying to optimize your approach. Thank you.
Thank you.
Fatima,
Yes, sir.
here, of course, ideally you have to finish all, but the patient, you have no time in the exam to finish all. If you still have time, you can do vibration, perception, and coordination also. Okay, so your task, the patient is 28 years, okay?
Okay, sir.
So the task here, 28 years, and the patient is sitting in the room, okay?
Okay. Can I start now, sir?
Okay, can I start?
Hi, I'm Dr. Fatima. I'm AD Registrar. May I know your name and age, please? Hello, sir.
We said before, if the actor is silent, you can proceed.
Okay, so nice to meet you. How can I help you today? Do you speak English? Is the translator available today? If there's no translator, so can you translate for me? Okay. Can you describe me more about what happened to you?
Yes, I was in car accident
When was the car accident happened?
1 hour ago.
Okay. So 1 hour ago, did you throw up from the car? Eject from the car?
No,
Was there any rollover?
no.
What was the speed of the car?
It was 90 kilometer per hour.
Okay. Do you have any numbness in the hand?
No,
Okay. So did you walk after the event?
no,
Did you have pain? Do you have pain in the neck?
yes,
When did it start? Was it soon after the injury?
no.
Okay. Are you comfortable now, or do you want any painkiller?
No.
Okay. So you are sitting comfortably now. So I want to do some neck examination of you, which includes looking at your neck, and I will touch your neck and I will feel that, and I will ask you to do some neck movements, and I will assess your hand also. Is that okay with you? Okay. Now I am inspecting the neck from the front of the neck, and I am inspecting the neck from the lateral side, and I am inspecting the neck behind for any injury, any wasting, or any evidence of contusions. And now I am palpating the neck from the anterior, the trachea and the carotid pulses, and feel for tenderness, warmth. And from the posterior, I'm checking the midline of the spine and checking the parasternal area. Is there pain? Okay. So I am going to ask you to do some neck movements. Can you look up? Can you look down? And can you turn your heads mm, both sides first? Okay. So the cervical rotation is intact. Initially, I have to do the all side cervical movements are intact. So now I am checking for the special test. I am assessing the power of the tone of the hand. Right hand, I'm shaking hand. The tone is the tone okay, normal.
What will you
Okay, now
say
I
to
am
the
assessing the.
actor? Talk to the actor. What is the instruction? What is your communication?
I am holding your hand and I'm shaking. Will you relax? If
Should,
there's
you
pain,
should
just let
say,
me know.
you should say, can you shake my hands? I want to shake the tone in the upper limbs. Can you shake my hands like that? Communicate with the actor.
Okay. Can you shake your hands with my hand? I'm assessing the tone of your right hand, and I'm assessing the tone of the left hand. Okay. Now I am assessing the active movements. Can you do like this? And don't let me press downwards. Okay. Right side. Other hand I'm checking. Can you do like this? Don't press me down. Okay. Can you do like this? Don't let me do push upwards. Okay. Other hand, can you do like this? Don't let me push up. So the shoulder abduction and adduction is intact. Now I'm checking the elbow. Can you do like this? Don't let me push in. Okay. So I'm assessing the other hand. Don't let me push in. Can you do like
Hand
this?
or elbow?
Don't let,
Hand or elbow?
elbows.
Okay.
Okay. Now can you push me? Now push outwards. Don't let me push outwards. And I'm checking the other hand. Okay, so bilateral elbow flexion and extension is intact. Now I'm checking the hand, supporting it with the wrist at the supporting, and I'm pressing your wrist up, down. Don't press it. Don't let me press down. So the wrist extension is intact in the left hand. So what about the right hand? Can you do the same thing? Okay, now I am checking the wrist flexion. Don't let me pull your wrist upwards, the left hand. So what about the other hand? Repeat the same thing. Okay, both wrist extension and wrist flexion is intact. Now I am checking the finger extension. Can you extend your neck fingers, and don't let me push downwards. Okay, I'm checking in the right hand. Don't let me push downwards. So the finger extension intact, the radial nerve is intact. Can you splay your hand? Don't let me push inside in your fingers. Left hand, I'm assessing. It is intact. Now I'm assessing the right hand. Uh, splay your fingers and don't let me push
Okay.
inside.
Thank you,
So the
Thank you, Fatima. Okay. You are doing well, but you have a problem in verbalization of the test. Okay. You have
okay.
problem in verbalization of the findings as well. You have problem in communication with the actor. Okay. You are trying to communicate with the examiner. So if you will say, I will ask the patient to, no, you are not talking to the examiner. You should talk to the actor himself, right?
Okay, sir.
So here regarding the tone, you should communicate with the actor. Communicate, it means how he will understand you. Okay? So I will check the tone in your upper limbs. Okay? And before the tone, you should inform him. Now I will check, for example, the nerves. I will check the nerves in your upper limbs. Clear?
Okay.
In the beginning, if you will say like that, the examiner will understand that you know the task. So I will check the tone in your upper limb. Can you shake my hands? Thank you. Okay, the other hand. Thank you. Now I will check the power. You said active movement. Is this active movement? No. Active movement, it means you will not touch the patient. Clear?
Okay, sir.
There is difference between active movement, passive movement, and the power. Active movement, it means the patient will do the movement for himself and you will not touch him at all. Passive movement, you will do the movement for the patient and he will not do for himself. Clear? Power, it
Yes.
means active movement against resistance, like that. I wish it's clear now.
Yes, sir.
Okay, so don't say active. You can say, now I will check the power in the upper limb. I will start by
Short.
shoulder. Excellent. Okay, don't let me push your shoulder down. But how you will say like that and you did not give him an instruction? So you should say, can you do like that for me? Okay?
Okay, sir.
Can you do like that for me? So communication first. You will get marks for communication. You will get marks for instructions. After instructions, you will give him the findings. whatever intact or compromised, normal or abnormal. Clear? So in the exam, if you find good resistance with the patient, you should say normal shoulder abduction and adduction, both sides. If you find weakness in any shoulder, you should verbalize that in the exam. For example, you are pushing the shoulder down and the shoulder you find floppy. So it means weakness. Okay? If you find strength, you should say intact. Clear?
Yes.
Okay. So can you do like that for me? Thank you. I will check for shoulder power. So don't let me push your shoulder down. Don't let me push up. The other shoulder, don't say hand. You are examining the shoulder or hand.
Shoulder.
So don't say hand, please. Okay?
Okay.
Okay. So don't let me to push your shoulder down. Don't let me push up. Thank you. The other shoulder. Don't let me push up. Don't let me push down. Thank you. Now, can you do like that for elbow power? So don't let me push your elbow down. Don't let me push your elbow up. The other elbow. Thank you. And then rest. Don't let me push your wrist down. Don't let me push up. The other wrist. Thank you. Here, you'll verbalize wrist flexion extension normal. Here also elbow flexion extension normal both sides. Here don't say finger extension. Yes, in wrist flexion or extension, it's not important to say the nerve, but in finger extension, better to say which nerve?
Radial.
Radial nerve. And this one ulnar, and this one medial. So in finger, don't say finger extension or samba abduction or blah blah blah. So just mention the nerve. So you can say radial nerve intact, both sides, medial nerve intact, both sides, and ulnar nerve intact, both sides, like that. Okay. Then sensation, then you will go for reflexes. Okay. So what is your management plan? So you should verbalize. I finished my examination. Are you comfortable? Do you have any pain? I will help you to redress. Do you have any question? I will verbalize. I will present my findings to the examiner, and then you will verbalize. So what will you say to the patient? You can get 30 seconds. You can proceed, doctor.
Management part.
Now you finished with the actor. Now you finished reflexes. What will you say in the station? You have patient, you have actor, you have examiner. Now you finished reflexes. I will give
All
you 30
findings
seconds.
normal. I have examined this 28 years old patient following RTA, and he has no high risk factors and he has low risk factors for Canadian C-spine rule. Therefore, he does not need any radiologic CT at the moment. And on examination of the bilateral upper limb power, there's no weaknesses there's no neurological weaknesses or nerve injuries found. Therefore, he's fit to discharge with analgesia, and I will give a letter to the GP. And I will, in any case of worrying symptoms, he can come to the A&E.
Okay, thank you.
If this
Thank you. Well done. Okay, so you can concise the approach. So you can say,